Right as I said that, my teleprompter went down. Okay, hang on. Hold on. We can, we'll have my producer cut this part. Sorry, Jamie. I know I'm making more work for you. All right. Welcome back to the Hopelessly Gifted podcast. I'm your host, Mark Talaga, and once again, we have an incredible guest, an incredible episode for you. I'm almost certain that everybody listening to this episode is going to learn something because we're going to be talking about something that I've only been recently introduced to, and it's fascinating to me, and I think it's just such a cool area for everyone out there listening to learn more about. As it relates to yourself, to your gifted kids, and just the population in general. So without further ado, though, I'd like to introduce my guest. Her name is Misti Peppler, and she is a core specialist in the Masgutova method of neurosensory motor reflex integration. She started training and using reflex integration techniques 15 years ago. Prior to that, she was highly trained in the AIRS sensory integration theory and techniques. She has worked as an OT in both private practice and school settings for over 25 years after teaching special education for 8 years. She's a mother to some spicy young adults, 2 of whom are adopted, and in her free time, she loves to garden and play with her new puppy. Welcome, Misti.
Hi there. Welcome.
Yeah.
I'm glad to be here today.
Oh my gosh, so excited. I think first and foremost, the best place to start is just let's talk about, like, if I were to ask you, what do you do? What's your job title? Like, obviously OT and all these other things, but how would you describe what you do?
So I take a look at an individual. It could be a kiddo or it could be an adult. And I'm trying to look at their nervous system and see where it's kind of glitching. And then let's work to improve that nervous system connections so that in the end, life is easier, right? It's all about helping families get to a place where life is easier because a lot of the people who come in here have a life that's just a little bit more difficult than it needs to be.
I can almost feel everyone's head nodding right now as hard as they can. So yeah, I think that's a very relatable statement. So when you say you work with the neuro system of these kids or adults, it sounds like you're really treating the physiological, their physical form. Is that what people come in to see you for? Do they say, oh, there's some physical issues we want to have assessed?
Usually people are referred, I'm going to be honest, most of my people who come in because they've tried a lot of other therapy. They've been in OT before and it's just not working, or they've been referred because there's just something a little bit off in the behaviors. And nobody's saying, hey, this is big enough to treat, but it's making life difficult in the home. And so they come in and they're coming in because of behaviors. And I say, hey, let's take a look at the nervous system and how that's responding to everything going on in the environment and their own body and work from there up.
Okay, I got you. And so what would like a typical client presentation be? Like, what's this, we get these kids all the time kind of a thing?
Gee, I think I see a wide range of individuals, but I think the most common are the little boys, usually
Mhm.
between kindergarten and third grade, that are struggling. They're struggling at school, they're struggling socially, and they come in and parents are like, we don't know what to do anymore. They're melting down. We're trying Cub Scouts. They melt down when we go to the outings. And so I say, hey, let's take a step back. Let's look at all the different things we can put in place. So I have coming from the world of special education, I have a strong behavioral background,
Mhm.
as well as looking at the underlying neurological things that I look at. So once we start working on those neurological things, I also help families to set in place the routines or structures they need in order to pull it all together.
Okay, that makes a lot of sense. And if you're kind of describing, some of these behaviors that come into your office, how do you explain to parents what's going on? What do you want them to understand? What's the foundation that you want them to know about your approach and what you're planning to prescribe?
So I started at the very basics. What is a reflex, right? And I talk about how most people these days know what the fight or flight response is, right? Most people have heard about that. They know that it's there. They're like, oh yeah, my kid's constantly in flight. He's constantly running away, or my kid's constantly in fight. So I break that down and I say, when I'm talking about a reflex, we have a reflex called the Moro reflex, that when we're born, we all have these reflexes that are there to protect us and help us survive. And the Moro reflex actually comes right in at birth. It's for that expansion of the chest for breathing. We take that huge first breath that we take. Usually our, shoulders come back, our arms come out. We take that big breath and then we kind of exhale back into flexion. And what happens when we're having the Moro reflex, it's kind of like it's that fight or flight, right? It's there to alert us something's going on. We need to prepare either to run or to fight, hunker down and fight. And it should leave us by the time we're 2 years. Actually, that one should leave us by about 6 months old. And when it doesn't leave, when it's constantly there, when it's constantly pulling up for us, our body constantly goes into fight or flight because that Moro response, that reflex that was supposed to protect us, is overactive and it's still protecting us. So that's where I kind of start with parents, is talking about that real basic emotional regulation that comes from a reflex when we're infants.
See, this is fascinating to me. So we have this reflex that we're born with that serves a very specific purpose, and then it's supposed to just develop out of us as we build up other things around us or other ways of being. Okay. And
Yeah, we call that integration.
integration. Okay, see, there we go. So, see, I'm learning. And then why would it be that some kids don't integrate or lose that reflex?
Well, the reflex is always there, right? What
Okay.
it's integrated. We build other skills on top of it, but it's always in our nervous system. So if there's some kind of traumatic event, or there's an accident, a physical or an emotional kind of thing, or if they're constantly and we'll get into this in a second, but our body will pull it up later in life, and we'll see this with people who have PTSD, right? Their Moro or their fear paralysis, which is another one of those emotional regulating reflexes, have been reactivated because they've been in a need where they needed to protect themselves. And then the body can't let go. It's working. Hey, it protected, it protected, it protected. It's working for me, even though it's not.
Right, right. Yeah.
When they come back, right? And so it's about teaching the body the sense of safety for it to be let go, and they don't need to rely on that anymore. Some kids, though, I really do feel we have a lot of those kids. Most people are pretty aware now about sensory processing. When I first started in OT, it was not as aware. People didn't know it, but now I can walk in and people are like, oh, yeah, they have sensory issues. But what a reflex is, it's a very specific sensory stimulation. Now, that could be auditory, visual, it could be proprioceptive, vestibular, it could be glandular, but it's a physical stimulus that promotes or has a very specific motor output. And so, if the sensory system is not working accurately, if the sensory system, we have all these kids who have sensory discrimination problems or sensory processing, they're over responsive or under responsive. If that sensory system is not working well, then the reflex is not going to integrate, because the sensory system is not allowing the reflex to express the way it should express. And then it doesn't have the strength, it doesn't build the strength in the neurosynapses to build that strong bond so that it can then integrate and we can build upon it. Does that make sense?
Yeah, yes, and also leads to like 100 questions. But no, it's fascinating because what I think I'm hearing is that we have a lot of overcompensation or maybe undercompensation going on in multiple areas. And
Yes.
if we have overcompensation in our sensory system where we're reacting like to, I don't know, give me an example, like a really loud noise. What would be, okay, give me an example of like that happening with one of these kids. Like, what would it look
Okay,
like?
so the loud noise specifically, I bring that one to fear paralysis all the time. So, fear paralysis is our startle reflex. That's kind of even under the Moro reflex as far as when reflexes develop. And the fear paralysis is the freeze. It's the intake of breath, the holding of breath, the freezing, and it helps us to take a moment, look around, and have that moment to evaluate a situation in order for our system to know, do we need to run, do we need to fight, do we need to hide, do we need to play dead, right? And so it is brought on by an auditory stimulus or a visual stimulus or proprioceptive stimulus. But a lot of times that auditory, that loud, that sudden loud thing. And, there's people who are like, oh, my startle reflex is really strong and I'm constantly jumping. And that's that fear paralysis. It didn't integrate all the way. And so you're constantly putting the nervous system into this freeze state. Then the mind goes blank, they can't think, and they can't take that step forward to choose what to do because they're kind of stuck in that fear paralysis.
So it activated this primitive reflex that we've had since birth. But
Right.
because that particular person is possibly maybe overly sensitive to sound, just neurologically speaking, it
Right.
activates this primitive reflex in a way that it's just a lot more constant than other people who may hear a loud noise and either the reflex doesn't get activated or just not as severely, or we can just process through the noise.
So the fear paralysis, yes. So the fear paralysis will mature and integrate and become the startle reflex. So we need that startle reflex, right? Because we still need to be aware of our surroundings and what's happening around us. And for most of us, we can hear that loud noise, we can jump, we can take in what's happening, and then we can come back to what we were doing when we realize it's not a threat. For people who have this retained fear paralysis, their system, their nervous system, is taking that noise as a threat, even though it's not, and putting them into that freeze state. Does that help explain
No,
that
it
more?
absolutely does. Yeah. If you see me like nodding, looking direct, I'm just so deep in thought because it's, I love what you're talking about. So yes, I'm with you. And hopefully our audience is too. But if not, they can always ask questions and reach out, and I'm sure you'd be happy to clarify.
Yeah,
Now,
absolutely.
I would imagine then that you have this Moro reflex, is what it's called, Moro reflex or Moro. Yeah.
Yeah.
Okay. Is there other reflexes, other things, primitive reflexes that we're looking at as well?
Absolutely. So most people who are looking at reflexes, they look at like there's 8 basic infant reflexes that they're looking at when they're looking at developmental delays or developmental problems later on. It would be the Moro, the spinal galant, the spinal Perez, ATNR, asymmetric tonic neck reflex, symmetric tonic neck reflex, tonic labyrinthian reflex, and the Palmer reflex, the grasp reflex. Some people look at the Moro reflex, which is a feeding reflex on the cheek. So those are kind of the 8 basic ones that a lot of people look at. In working with Dr. Masgutova's work, she looks at something like 27 different reflexes.
Wow.
Yeah.
Yeah.
And and I look at those as well. So I look at those basic ones, but sometimes those basic ones we don't get to because we have to work on these what I call the regulating reflexes first. So those spinal reflexes, the spinal galant and the spinal Perez, have a lot to do with, are highly associated or correlated with ADHD in research studies. And so those are movement or tactile input along the back, right? So you think about those kids that are constantly squirming, right? If you have a spinal galant reflex, if you were to run your finger down the side of one side of the spine, the body may react by flexing on that side. And the other side, they might react by flexing on the other side. So you think about these kids who are sitting in a chair and their back is constantly being stimulated,
Right.
right? And so they're constantly being going, this is retained and their body is constantly moving in what is a reflexive movement. And they can't find that stability in the middle because they're constantly overreactive to this spinal galant. So you get a lot of movement, you get a lot of readjustment, you get a lot of those kids that just can't sit still. Oftentimes you'll look at that spinal galant and that spinal galant will be active.
And again, it sounds like to test for that, I'm sure maybe it's more complicated than this, but just that simple kind of taking your hand down the backside of their spine and seeing that reflex kick in would tell you a lot pretty immediately that, okay, we got a wiggle kid, right? And then my head goes to, I'm sure there's a lot of other physical stimming behaviors that are maybe more related to the actual reflex system, the primitive reflex system, than perhaps something like, just straight, it's autistic behavior, but it's possible it's more in this realm of primitive reflex.
It may be,
Maybe, right. Yeah.
absolutely.
See, and so again, whenever we're working with these very complicated kids, I always push people, don't look for the simple thing, always make it a little more complex. We're always assessing, always evaluating. So I think this is a great way to expand people's awareness of, hey, maybe I don't have a sense of what's really going on here. I would love to hear about some more reflexes examples like that one with the spine or the one with the loud noise. What are some other ones?
So the palmar grasp, that's on the palm of the hand, right along the ridge of the fingers, right? So if our palmar grasp, and it forces our hand into flexion, it forces the hand as a reflex into a nice little grasp. And there's all these developmental growth out of that from this real basic pattern into a much more complex pattern where you can hold a pencil and manipulate a pencil, hold a toothbrush, manipulate the toothbrush around in your mouth kind of thing. And what I find fascinating is that I work on that a lot. When I worked in schools, I was working on palmar grasp a lot because a lot of those kids are referred for handwriting issues. And I find that they can't hold a pencil accurately. And I was working with a kiddo who he was 5th grade. He'd been in OT since kindergarten, right?
Yeah.
Could not hold a pencil. I'm seeing him doesn't like to write, avoids writing at all costs, and refuses to use a pencil grip because he says they hurt his fingers, right? And so I'm working with him for a couple of months. I'm working on that pencil grasp. Now he had some other sensory issues we were working on too. It wasn't just his pencil grasp or his palmar grasp, but one day as I'm working with him, I have a little room in that school, and he's laying on the floor, and I'm working on the grasp reflex. I'm working that. And I looked down his body, and I realized, because he'd taken his shoes off, that his toe was coming up, his fingers were splaying over and over in a pattern, which is the Babinski pattern. And I'm like, oh, he's grounding, like he's compensating. His body can't do this grasp here. It's so hard for him. So his Babinski, this other foot reflex, is kicking in to help him do this, right?
Wow.
So I start working on the Babinski, and he's like, "Why you're working on my feet?" I'm like, "Well, because we want to work your feet too, because they're kind of showing us that your hand grasp isn't going to come in." So after working, it usually takes like 2 months for a reflex to in a more neurotypical kind of person to integrate. But after about 3 weeks of working on the foot reflex, the Babinski, I went to his teacher and I said, I always go and check in. Hey, I'm checking in. Any differences? She goes, no, he still won't use a grip. He still won't hold the pencil right. But let me show you his writing notebook. Suddenly he's writing pages.
Interesting.
Yeah. And so then he comes in like the following week, and he's like, I can't write today. I have a sore on my finger. I'm like, well, how about this? I got this really soft, squishy grip. Why don't you try that? And then your sore won't hurt. Right. So he tried it. For the first time, he allowed it to happen. And he's like, oh, I like this. Do you think I could use this in the classroom? I'm like, no problem.
Oh my gosh.
And then the following week, I said, hey, I think there's even a better grip than that one for you, because different grips do different things, right? So I give him the other grip, and he's like, oh yeah, I like this one too. Let me use this one. And like 3 weeks after that, he comes in, and I had a little bin of pencil grips in my room, and he had drawn every single grip that I had, from the most formed one, which he was using, to the very least formed one. And he said, I'm going to go through all of these, and then at one point I won't use a pencil grip anymore.
Oh my gosh. How cool
Right.
is
And
that?
then by the end of that school year, he was holding his pencil accurately. He was writing what he needed to write, the amount he needed to write. And so, yes, I was working on the palmar grasp, but sometimes the nervous system mixes things up, and his brain, that Babinski, was mixed up with his palmar grasp. And when I worked on the Babinski, that freed up the nervous system. Oh, I don't need to do this. I need to do this. It kind of teaches the nervous system what it needs to be working on in order for the skill development to build on top of that.
Yeah, and honestly, the thing I'm reacting to the most out of that really lovely story is the idea that once his nervous system was relaxed, once the actual issue is being treated, his first mindset goal was to start to do the thing. He didn't need convincing around it. He didn't need to be told why it's important. He just naturally, because all kids really want to do well and want to do right by the people in their life, started to just activate and then start to sort through strategies and how to grow. And to me, that is just the most positive thing you could teach people out there, is when you start to really address the real issue that's underlying the resistant behavior. You don't have to go through the art, for the most part, it's not always this way, of convincing and trying to get them on board. They want to proceed now that it's been relieved. I love that.
Yeah. Yeah, absolutely.
How
Absolutely.
cool. So a part of me wants to hear so much more about some of these other examples, which I think we probably will do. And then the other part of me wants to get into what I'm sure a lot of people are wondering. So what do we do about this? How do we treat this? What are some of the interventions? What does it look like? Is it long? So, but before we go there, I'd like to hear is more. I've heard ones about like kids that struggle to tilt their head back, like in the bath to get their hair washed.
Yeah.
And that could be a reflex, primitive reflex
That's
kicking.
Moro.
Moro.
That could
Okay.
be Moro,
Okay.
or it could be the tonic labyrinthian reflex. It could be both or either.
Okay.
Yeah.
And then what are some other ones that maybe parents would assume is maybe just quirkiness or something else that you find, oh no, it's actually a reflex-based behavior?
Yeah. So the ATNR, the asymmetric tonic neck reflex, is a huge reflex for learning. It's auditory and visual, right? So that's the reflex that when an infant hears something to the side, they turn to look at it, and that arm on that side extends out like they're reaching towards it, and that leg will stay extended. And then the arm and the leg on the other side flex and come up and come in. And then if they were to turn their head, the arm on the other side would go long, and their opposite arm would flex.
So
right?
if I can give a visual for the listener, imagine a little tiny baby who has that big yawn, and they stretch out with that one arm and the other arm kind of comes in chicken wing style. That's kind of how I see it, except they're turning towards whatever the sound is while they're doing it.
The head needs movement and turn is the stimulus.
Got it.
The sound is the stimulus to turn the head, but their head turning stimulates this extended arm and flexed arm
Okay.
and extended leg, flexed leg
Got it.
position, posture. So, there's an auditory stimulus to get the head to turn, but they're looking for something, right? So
Hmm.
there's auditory visual patterns which are developing as they do this. This is what we're developing, right? You hear something, you turn to look and see it. You hear something, you turn to look and see it. So that's what's supposed to be developing. But if I get stuck with every time I hear something that I have to turn, I can't maintain my focus in the middle,
Right.
right? And as well as this is a huge reflex for that cross brain, hemispheric brain movement back and forth, right? Getting information to process back and forth. And so kids with AT&R difficulties often have auditory processing problems. They have learning disabilities, right? Learning problems, reading, comprehension. They also often are those kids that people are like, they're ambidextrous. They use either hand. They can't find a hand to
Interesting.
use to become good with one hand. Um, and when one hand tires, they flip the pencil to the other because our handedness becomes solidified in our body, in our brain, once we can come to the midline. But if we're constantly moving from our right to our left by whatever stimulus is giving us, and we can't come to that midline and stay centered in the midline, then we can't form our handedness so that it's strong on one side. Does that make any sense?
So what I'm hearing then is these kids are almost kind of caught in this flip from going from left to right, both in their actual hemisphere, the hemispheres of the brain, but also physically left to right.
Mhm.
And there's no midline. And when you say midline, you mean they're just either like looking at something dead straight, or they're able to integrate both sides of their brains in a way so they're connecting maybe the language part of their brain with some other part.
Right.
Okay, so yeah, so the learning issues would be very clear there because both sides of the brain aren't working.
They're not working
There
together.
we go. Okay, they're not working together. Yeah,
Yeah.
that could be a big issue.
Yeah.
Fascinating. And let me ask you this then, because I'm going now to adults. And would you say that this is exceedingly rare for adults to have, or would you say it's actually more common than people think? Or where would you put it for people that are maybe in their 20s or 30s or 40s?
I think it's more common than people think. I think as we mature through childhood, we learn compensations and we compensate over and over and over for it. And so that just becomes a part of who we are. We're compensating and we don't know it. And it depends then as you get older, how much does it interfere with your life, right? How much is whatever's happening and how much is your compensation causing stress on your body and stress in your system that's interfering with life? So definitely I think there's and these reflexes, like I said before, can be pulled up because of something that happens to us, and we start using them without knowing, right? How many people know that they're compensating by using a reflex as
Here,
opposed
let's
to,
pause. We're going to pause there.
I was
Yeah,
going to say, I heard it coming.
that's all right.
So, how many people know that they're using a reflex as a compensation as opposed to actually moving through whatever task they're doing or whatever emotional stress they're having with ease because they can do it and they're not relying on a more primitive nervous system response?
Yeah, and so I'm imagining you like walking down a crowded street, and are you at that place where you can kind of pick it out, and people are like, "Oh, that's one of the reflexes. There's a primitive reflex," or something like that?
Well, yeah, the way people move,
Yeah.
I'm definitely looking at their tone. I'm looking at, yeah, their reactions.
Yeah. Well, I was just curious, what are some of those things that, because again, it's so, for certain people, it's like, well, this is how I am. This is, what I do. It reminds me of a story. There was a kid where, I'll keep this kind of short, where somebody was asking him, is like, well, when you look up at the sky and you see the moon, like, what does that look like for you? And he's like, well, which moon? And they're like, what do you mean, which moon? He goes, well, there's two of them. And they had no idea that this kid had split vision, like a binocular issue,
Yeah.
because he just thought, oh, there's two moons, right? And everybody knows that. And so not until it's called out do you start to see these things. So what are some things that people maybe should be looking out for? And I know it's probably very subtle, but sometimes maybe it's a little more egregious. What should they look for?
I actually have somebody coming in to see me this week who is like, my startle reflex is over the top. Like, even in my own home, my daughter coming down the stairs will announce she's coming down the stairs before she comes down because she knows she's going to startle me. you know.
Yeah. So
So
something like
yeah,
that, they realize, okay, that's a reflex that is just happening without my control. And I want to look into what we can do about that.
yeah.
Okay. So talk me through then is, the process of starting to integrate these primitive reflexes back into just the way of being. Is this a years long process? Is it takes a couple, like, what do you do about it?
So it's a big discussion right there. So there's two big, I'd say, theorists right now of how to go about and integrate reflexes. And Sally Goddard did a lot of work in the 1970s and developed some exercises, movements. We use movement to integrate because remember the outcome of a reflex is movement. And so we use that movement in order to integrate it into the system. But what she was doing, what she was working on was actually inhibiting, right? So I'll take that ATNR for an example. If the head turns to the right automatically and that arm extends, she's going to practice, instead of extending that arm, she's going to practice having the other arm extended while turning away from the extended arm and bringing the arm that she's looking at into flexion, right? So inhibiting the brain from moving into that reflex. So a lot of the exercises and activities that are out there are based on that kind of inhibition model. And there's, rhythmic movement therapy, there's Malello, there's a bunch of other people who've started doing a lot of this reflex work, but it kind of comes from Goddard's work on inhibition. And they say and they're saying they're integrating it by moving into these inhibition patterns. Dr. Masgutova and the Masgutova method kind of took the opposite turn on that. And they said, wait a minute, if the brain didn't get it when they were an infant, right, that by turning my head and extending my arm, if I don't have control of that, then why am I going to try to inhibit that? I need the brain patterns. I need the synapses in the brain to know that that's the pattern that has to happen. So that's the way I work. I work with taking that pattern and doing that pattern slowly and with control,
Hmm.
right? So we're moving through that pattern and we're showing that we have complete control of movement in that pattern, those patterns, whatever the reflex is. Once we show we have control with that pattern, then we move into like that inhibition pattern or a variant of the pattern, and we start having control in those other patterns that move around the reflex so that we can have freedom from that reflex, so
I
that we can move freely in all our ranges.
So let me see if I got this. The Goddard method is more about you're going to do this move and it's going to create a reflex, but we're going to consciously inhibit that reflex by doing something like the opposite or switching arms up. But Masgutova is more about let's first not let that reflex be so automatic, but a lot more conscious and in control.
Yes.
And then we can start to shift it to a different pattern. But you're in the Masgutova method, you're learning more how to create, I don't like this word, but the correct response, like what you're wanting your body to
Yes.
do. Okay. Yeah.
Yeah,
Makes sense.
because all our movement patterns build on that, right? Like all of our controlled movement builds on the patterns from infancy. And so if the brain doesn't have that, if the synapses are not automatic for that with control to build on top of that, then we're kind of leaving holes
Right. Yeah.
in the nervous system.
Makes sense, right? And we're trying to close as much of those gaps as possible. So, step one is recognizing the gaps, paying attention to kids or adults who are having, again, just very kind of automatic responses or very gross motor, fine motor responses, or trouble with certain
Hmm.
things. That's kind of where we start saying, hey, maybe we should look into the reflexes. And then it's determining how many reflexes are playing a part of this because it never sounds like it's simple. Like there's all sorts of different things. And then from there, creating a routine or the intervention to help, exercise through that with the goal of integration. And again, is it now when we're reintegrating and we're working through that process, is it uncomfortable for the people doing the exercises? Does it tire you out? Is it freeing? What does it typically feel like for these kids?
That's an interesting thought and question. So the more neurotypical you are, the easier it is
Okay.
to integrate, right?
Yeah.
And one time when I was learning the method, I was working with a therapist, and there was a child who he had autism and he had no rotational movement. Like he was a kind of a brick, those kids that really don't have trunk rotation, head rotation. And so one of the things we work on are these underlying archetype movements. And we were working on rotation and he hated it. Like
Mm,
he hated it. And And the way we work on it is like we move the head, then we move the shoulders, and we kind of hold there with the shoulders rotated, but the hips not. And then we allow the hips to come. And he hated it. And I said, gosh, I would love it if somebody would stretch me out this way.
Right.
That looks so, like
Yeah.
that, like my body looks at that and goes, wow, I would love to have like some real nice rotation like that. And the therapist said, yeah, but his body's never known it. And so he's afraid of it.
Mm.
And that's why this is hard for him. So the answer to your question is like for some kids, yes, it can be easy once they're consciously working it. And then for other kids who've never had that movement in their life and don't understand it, it can be really scary.
Yeah.
So then it's really
Right. And I think it's just good for parents to know that going in, that just because there's this perhaps resistance or scariness around it doesn't mean it's hurting them. It's actually might mean, hey, this is actually being quite effective, but it's such a new sensation, such a new movement. The brain doesn't really know what to do with it just yet. Okay, that's good to know. Sounds like actual therapy, to be honest. It's like, in my work, just because you're not having a good time right now doesn't mean we're not doing some real work,
Exactly.
So that's fascinating. Now, I would imagine that there is a lot of misdiagnosis of kids that could be better explained through the primitive reflex, issues at its base. Is that something you encounter or something you have thoughts on?
Yeah, I'm not going to go down the path of saying there's a lot of misdiagnosis.
That's
I
fair.
do think that the reflexes play into a lot of the symptomology of many of the, I don't want to call them popular, but common diagnoses that kids are getting, whether it's anxiety or ADHD or PDD or, all of those different OCD, all those different diagnoses, I think reflexes play a role in what the symptomology of those are. And when you start treating the reflexes, that symptomology quiets down.
So it doesn't need to be either or. It's not, oh, you don't have this, you have this. It's more like, let's broaden out the variables of what's contributing so that we can better, have a plan of attack for how to alleviate some of the symptomology.
Yeah.
Got it. Okay. Yeah. Sorry, I didn't mean to put you on the spot.
No, I mean, people are always like, especially with autism, I think they think, well, it's their sensory issues or it's their reflex issues. And I'm like, you know what? I think the brain is still wired the way the brain is wired. But if we can make an impact on the symptoms and make it easier for them to just be in life without so much difficulty, then let's work there.
Do you feel like this is going to be something that becomes more and more integrated into like the school system and the awareness of, or maybe it already is and I'm just not aware of it, because it feels like this is still such a unique area to look at things that it doesn't get brought up very much. But I don't know, it feels like it should be part of just how we assess for all kids. Do you feel like it's moving towards being more Yeah. What gets in the way of it being mainstream, do you think?
The emphasis on, let's see, a couple of things. When I first started, right, sensory integration was not considered research based and it was not considered like appropriate for school systems. The last several schools that I've worked in, they have sensory rooms now. They have a special room set aside to take care of sensory needs. And they, anytime a behavior comes up, they're like, I think the OT needs to be involved because I think it's sensory. And it just took time for the research to catch up with what the clinicians were seeing. And I think with reflexes, that's the same thing that's happening. The research is taking place right now to say that, yes, the correlation between kids who are still bedwetting at 8 and 9 and have a retained spinal gallant is pretty significant. And when I treat the spinal gallant in kids, like some of those bedwetting issues start to go away. So yeah, I know clinically what I'm doing makes a difference. I know the research is catching up right now to what we know is making a difference. But are there huge research studies that say if I treat all kids with ADHD this way, is it going to improve? There aren't research studies for that right now. And part of that's every kid with ADHD is different, right? Their nervous system is different. So why would you give them one protocol in order to to address their needs.
Well, that's the thing. I always say that if anybody's out there, it's like, oh, I know how to treat all gifted kids. All you do with gifted kids is do this. And I'm like, whoa, well, hold on now. Every single one of them is their own little flavor of something. And there's so many compounding parts to each of those specific unique children that, no, so there's not one thing. So I agree with you on that for sure. So if people are interested in learning more about this, I think it's fascinating. I love learning about it. Where would you direct them to? I know you have a website. Is there other resources that you would recommend?
I do recommend going to the Masgutova method.com, which is Masgutova. I'm going to spell it out because I didn't know how to spell it the first time.
It sounds like there should be a K in there and there's not. No. Yeah, you could spell it out.
It's Masgutova. I believe I got that right.
I think that's right. Yeah.
And then it's masgutovamethod.com. And she has a lot of her research there. It's a very dense site. She's a psychologist by training from Russia, and lots of dense information there. But if you just start kind of Googling reflex integration, you're going to come up with a lot of people who've put out information which is pretty accurate, I think, as far as what a reflex is. And then it comes down to how do you treat it? And, as I talked about before, I'm not about inhibiting, I'm about really strengthening that pattern and having control with that pattern. So that's what I kind of would suggest people look at. Which methods are they basing their exercises on?
I love it. And then where can people find you? What's your website?
It's pretty easy. It's pepplerot.com.
Great. Yeah. And then where do you practice out of, just so people know?
I practice in Elgin, Illinois, which is northwest of Chicago. 40 minutes. I'm 30 minutes from the O'Hare. So,
well, I guess maybe this is a question too, and maybe other people are different. Do you feel like this is something that you need to be in person for? Is there a chance for this to be something where you could help people remotely, or is it because of the physical nature of it, really needs to be in person?
That's a good question. I think that I like to initially really see my people in person first. And I do that a variety of ways. You can come to see me each week. I do intensives. You can come to see me for a few hours on a Saturday and then go home with a home program. I'm very intense on home programs because coming to see me even every week, it's the home program and doing the exercises at home that's really going to make a difference on the nervous system. So I set that up the way that makes it easiest for the family. I do see a couple of people online, but that's after I've seen them for a while, right? I know that they know the exercises. I know that the parent knows how to do it and complete it. I know that they follow through on them. So those people I will see online and do check-ins with them and say, okay, let's try this instead of that with this exercise if that's not quite working.
I got you. Okay. So the ideal is, yes, to be there in person, but there are options. I just try to think of all the people, over the country that might be listening to this. So I want them all to have access to care. Okay. Excellent. Well, anything else that you feel like we missed or didn't pick up on, or is there something you really wanted to hit home for people listening?
Gee, that's a pretty broad question
I
for me
know.
right now because my mind goes 10 million ways. I think that parents can have a huge impact on their child's development in that, the parents that come to me, they're like, oh, I can't do that. I'm like, yeah, you can. And I teach them, like I go through what I'm doing on the table with the child and I teach them how to do it. And I find some parents are absolutely amazing and have amazing hands. And I tell kids that I'm like, gosh, your mom's really good at this, because I think parents aren't a lot of times given the credit that they should get for being a person who can do intervention with their child. So they shouldn't be afraid to jump into it. I guess that's the big thing that I would say to parents.
No, I love that. The idea that you could empower the parents to be the one that helps with their kids and to help, maintain some of these exercises and programs so that they see results. I think that's great. Absolutely. Cool. Well, I'll tell you what, this was an absolute blast talking with you today, Misty. I really appreciate you taking the time. For all the listeners out there, we will link the Masgutova method as well as Misti Peppler's website in the show notes so that you can find her easily. And as always, if you have questions, concerns, confrontations, anything that brought up a reaction in you, please feel free to share it with us at our website, hopelesslygifted.com, or on social media as well. Misty, thank you again. It was so nice talking with you.
Thanks for having me.